Welcome to Idea Sessions. In this video, we will cover 10 different types of depression. Major Depressive Disorder, MDD. Major Depressive Disorder, MDD, is a serious mental health condition characterized by persistent and overwhelming sadness, a loss of interest or pleasure in activities, and significant disruptions in daily life. People with MDD often experience a combination of emotional, cognitive, and physical symptoms that last for at least 2 weeks. Key characteristics include feelings of hopelessness, worthlessness, or guilt, difficulty concentrating or making decisions, and changes in appetite or sleep patterns, insomnia or oversleeping. Physical symptoms such as fatigue, low energy, or unexplained aches and pains are also common. In severe cases, thoughts of death or suicide may occur. MDD differs from normal sadness or grief, as it is more intense and long-lasting. Effective treatments, including psychotherapy, medications, and lifestyle adjustments, can help individuals manage symptoms and improve their quality of life. Persistent Depressive Disorder, PDD. Persistent Depressive Disorder, PDD, also known as dysthymia, is a chronic form of depression characterized by a low, gloomy mood lasting for at least 2 years in adults, or 1 year in children and adolescents. While its symptoms are less severe than major depressive disorder, MDD, they are persistent and can significantly impact daily functioning and quality of life. Key characteristics of PDD include feelings of sadness or emptiness, low energy, poor self-esteem, difficulty concentrating, and changes in appetite or sleep patterns. Individuals may also feel hopeless or struggle to find joy in activities. Because the symptoms are milder, they are often dismissed or attributed to personality, leading to delays in seeking help. Treatment typically involves psychotherapy, medications, or both. Building supportive relationships, maintaining healthy routines, and managing stress can also play a vital role in recovery. Bipolar disorder. Bipolar disorder is a mental health condition characterized by extreme mood swings that include episodes of mania, elevated or irritable mood, and depression, low mood. These episodes can last days to weeks and significantly impact daily life, relationships, and productivity. Manic episodes are marked by heightened energy, reduced need for sleep, racing thoughts, impulsive behavior, and an exaggerated sense of confidence. In severe cases, mania may lead to risky decisions or psychosis. Depressive episodes, on the other hand, involve intense sadness, fatigue, hopelessness, difficulty concentrating, and possible thoughts of suicide. Bipolar disorder has different types. Bipolar I involve full-blown manic episodes, while bipolar II features milder hypomanic episodes and depressive phases. Treatment typically includes mood stabilizers, psychotherapy, and lifestyle adjustments to help manage the condition and maintain stability. Early intervention is crucial. Postpartum depression. Postpartum depression, PPD, is a serious mental health condition that occurs in some individuals after childbirth. Unlike the baby blues, which are mild and temporary mood swings lasting a few days to weeks, PPD is more severe and can persist for months if untreated. It affects the mother's ability to bond with the baby and manage daily responsibilities. Characteristics of PPD include intense sadness, overwhelming fatigue, irritability, feelings of inadequacy or guilt, difficulty bonding with the baby, and changes in appetite or sleep patterns. In severe cases, it may involve thoughts of harming oneself or the baby. PPD results from a combination of hormonal changes, physical exhaustion, and emotional adjustments. Treatment typically includes therapy, support groups, and sometimes medication. Early recognition and intervention are essential to promote recovery and ensure the well-being of both mother and child. Seasonal affective disorder, SAD. Seasonal affective disorder, SAD, is a type of depression that occurs at specific times of the year, most commonly during fall and winter when daylight hours are shorter. It is linked to changes in sunlight exposure, which can affect the body's internal clock, serotonin levels, and mood regulation. Characteristics of SAD include persistent sadness, fatigue, difficulty concentrating, increased need for sleep, and loss of interest in activities. Many individuals experience changes in appetite, particularly cravings for carbohydrates, leading to weight gain. Symptoms usually resolve in spring or summer when sunlight increases. SAD can disrupt daily functioning and quality of life. Treatments often include light therapy, exposure to bright artificial light, psychotherapy, and sometimes antidepressants. Spending time outdoors during daylight hours and maintaining a consistent routine can also help manage symptoms and improve mood. Atypical depression. Atypical depression is a subtype of major depressive disorder, MDD, with unique characteristics that differentiate it from other forms of depression. It is called atypical because individuals experience mood reactivity, feeling temporarily uplifted by positive events, despite persistent depressive symptoms. Key characteristics include increased appetite leading to weight gain, excessive sleep, hypersomnia, a heavy feeling in the limbs, leaden paralysis, and heightened sensitivity to rejection, which can affect relationships and self-esteem. Unlike typical depression, where energy levels are consistently low, people with atypical depression may have fluctuating energy. The exact cause is unclear, but involves a combination of genetic, biological, and environmental factors. Treatment often includes psychotherapy, lifestyle changes, and specific antidepressants such as MAOIs or SSRIs. Early recognition is crucial, as the mood reactivity aspect can sometimes mask the severity of the condition. Psychotic depression. Psychotic depression is a severe form of major depressive disorder, MDD, characterized by depressive symptoms accompanied by psychotic features such as delusions or hallucinations. These psychotic symptoms are typically congruent with the depressive mood, reinforcing feelings of worthlessness, guilt, or paranoia. Key characteristics include profound sadness, fatigue, loss of interest in activities, and difficulty concentrating, combined with delusions, false beliefs, or hallucinations, seeing or hearing things that aren't there. The psychotic elements often center around themes of failure, guilt, or perceived personal inadequacies. This condition can significantly impair functioning and requires immediate intervention. The exact cause is not fully understood, but involves a combination of genetic, biological, and environmental factors. Treatment typically includes a combination of antidepressants and antipsychotic medications, often paired with psychotherapy. In severe cases, electroconvulsive therapy, ECT, may be considered. Premenstrual dysphoric disorder, PMDD. Premenstrual dysphoric disorder. PMDD is a severe form of premenstrual syndrome, PMS, that causes significant mood disturbances and physical symptoms in the 2 weeks leading up to menstruation. Unlike typical PMS, PMDD can severely affect daily functioning and emotional well-being. Key characteristics of PMDD include extreme irritability, mood swings, anxiety, depression, and feelings of hopelessness. Physical symptoms often involve fatigue, joint or muscle pain, headaches, sleep disturbances, and changes in appetite. These symptoms typically subside once menstruation begins, but can severely disrupt work, relationships, and general quality of life. The exact cause of PMDD is unclear, but may be related to hormonal fluctuations and changes in serotonin levels. Treatment often includes lifestyle changes, stress management, antidepressants, and hormonal therapies. Early diagnosis and intervention are essential to effectively manage PMDD and improve overall well-being during the premenstrual phase. Situational depression. Situational depression, also known as adjustment disorder with depressed mood, occurs as a response to a specific stressful life event or situation, such as the loss of a loved one, a breakup, job loss, or major life change. Unlike other types of depression, situational depression is triggered by external circumstances and the symptoms generally improve once the individual adapts to the situation or the stressor is resolved. Key characteristics include feelings of sadness, hopelessness, irritability, difficulty concentrating, and changes in sleep or appetite. People may also experience anxiety, fatigue, and a reduced ability to enjoy daily activities. The symptoms are typically more intense than a typical reaction to stress, but less severe than major depression. Treatment often involves psychotherapy, stress management techniques, and social support to help individuals cope with the stressor. Unlike chronic depression, situational depression is often temporary, with recovery occurring after emotional adjustment. Treatment-resistant depression, TRD. Treatment-resistant depression, TRD, refers to depression that does not improve after trying multiple treatment approaches, such as different antidepressant medications or psychotherapy. Individuals with TRD often experience persistent symptoms of sadness, fatigue, hopelessness, and difficulty concentrating, despite attempting various treatments. The condition can be particularly challenging and discouraging as it may require more specialized care. Key characteristics of TRD include enduring low mood, disrupted sleep or appetite, and a lack of interest in activities, which do not respond to standard treatments. This form of depression may also be associated with greater levels of disability and a lower quality of life. Treatment for TRD often involves alternative approaches such as higher doses of medication, combination therapies, ketamine infusion, transcranial magnetic stimulation, TMS, or electroconvulsive therapy, ECT. The condition requires careful monitoring and a tailored treatment plan to find an effective solution. Each type may require different treatment approaches, so professional diagnosis and tailored interventions are critical. We hope this video helps you, and check out our other video related to mental health.